So if you're having any knee pain, a good place to start is to do bridging practice. And I don't mean crazy like bridges and acro like we're about to do a walkover. I mean baby bridges. So what Ms. A is going to do is feet are hip width apart. She is in, again, parallel. Arms are narrow by her side. She's going to bridge her hips up, but if I don't cue the feet, see how she's really going to load and hinge in the back. That's not what we want, okay? She's going to come down. So proper bridge, she's going to think push into the feet, preferably the heels, and almost send her knees on a trajectory past her toes. And notice how that gets more length in through the back. Then she's going to lower down. She would practice those 2-leg bridges, about sets of 10 for about a week. And then when she's mastered that, we ramp it up a little bit. So she's going to bridge her hips up, send the knees long. She's going to fold one knee in towards her chest, and she's not going to let her hips tip to one side. She would hold for ideally 3 breaths, really pushing into that right heel. Foot comes down, butt comes down, and then she would do the other side. All right, so another one of my favorite types of bridges, because it forces the kids to really put weight in their feet, is to do it with arches up on the roller. So she's going to keep the roller stable, and she's going to bridge her hips up, and again, pushing into her feet and sending her knees almost on a diagonal, keeping length through the low back. Hold there and breathe. She's really feeling hamstrings at this point. And then she's going to roll down through the spine. Pelvis rests, good. And she can give her hamstrings a little break. And don't you know, she can do this one leg. So she's going to push into her feet, bridge the hips up. She can gaze at her hips in space, making sure they stay level, and could she float one leg up? Oh, yes, she can. She's been working on her exercises. Nice. Again, holding for 3 breaths, thinking about the standing leg, foot comes down, roll down through the spine, and call that done. Again, I would do about 10 reps on each side. The focus is the standing leg, not how high the hips necessarily come. All right, the next main exercise I would have them practice is, again, notice she's in parallel, even though she's a beautiful dancer. We are not working in turnout yet. So we have to teach these kids how to squat because they're only used to doing a plie. So to set it up, she's going to pitch her torso forward and stick out her butt, keeping the legs straight. So she's really reaching her shoulders past her hips. Now she's going to bend the knees. And again, I put the dots there because we're watching, is she lining up knee over second toe? And then stand up. And she would do that again. She sits the hips back and down, weight is in the heels, and come up. Last one, helps to do this in the mirror so she can watch her own knee tracking. And again, really sending the hips back in the opposite direction as she counter reaches forward. Last one, folding at the hip and coming up. The main difference between a plie and a squat is if she does a demi-plie in first position here, notice we're not sitting the hips back, the weight is not in the heels, and we're keeping the shoulders stacked over the hips and come up. That actually puts a lot of pressure in the knees. So if they're not having happy knees at the moment, we're going to do more squat type movements rather than plies.